Let's talk about an emotion that's often misunderstood and even more often avoided, which is anger. Whether it shows up quietly as resentment, erupts when we least expect it, or gets buried beneath anxiety and burnout, anger is something many of us have never learned how to safely feel or express. Dr. Paula Maness knows his work well. She's a clinical psychologist, trauma specialist, and someone who shows up with honesty, compassion, and faith. Paula works with high achieving adults, men and women, who carry a lot on their shoulders like all the time. On the outside, they look like they're managing, but inside, they're overwhelmed and holding back emotions that feel too risky to release. In her work, she helps people move from survival mode to a place of clarity, connection, and real emotional peace. I'm Kiara Brown, and in my therapy practice, I work with people who feel stuck in survival mode, whether from anxiety or past traumas, and help them find safety and calm again. So I know how much courage it takes to face what's beneath the surface, and that's why conversations like the one you're about to hear with Paula and I matter. So just a heads up, we had a couple glitches in the recording because technology things happen. But the heart of the conversation with Paula and I is so strong, and it just was just a whole great conversation. So I literally cut very little out of the conversation. That's why it's longer than my other conversations that you've seen so far on my podcast. But Paula just has so much experience and knowledge in the therapy field that I felt cutting anything out would do a disservice to our conversation and just her knowledge base. So please hang in there when the tech glitches happen and just listen to the end, because there's so many like golden nuggets throughout the video that as fellow therapists I feel like we all relate to in some way. So just let's dive in, and at the end of the video I'd love to hear any comments and feedback that you had from the video or any takeaways. So let's get into it. Hi, Paula. So happy to get to talk to you today. So I know we talked about a little bit about what you've been doing and kind of like what you've been like moving towards. So I'd love to hear more about what you're been up to, kind of like your passions in the therapy world. So what's new?
Well, I got to tell you, first of all, I'm really excited because I'm very happy to connect with you. You are so amazing, and I am really excited about this particular piece. I too am. I have been so busy, and I know like everybody says that, but truly I have been, and it's not because I've been playing outward. I've been, which is my current favorite video game. I am shifting my flow client has always I've always been connected. Our flow clients are generally people that we find out that they're kind of us in a different form, right?
Yeah.
We're connected to them and we can relate to them. And that was, my flow client was like most of us who go into this field, of course, someone who had experienced trauma, right? And a female, and someone who's in my age group. So the thing is, the problem is I'm old. And so, okay, well, I'm not old, but I'm not 20 anymore. And so the reason I say that is my age group is people who are in their 60s, 60 to 85 or so. So
You don't look
the
60, so I
problem with,
can't even like fathom that.
right? Oh, I
You
don't
don't
look
look
60. Yeah.
you don't look it.
Thank you. So the problem with that is they're all on Medicare,
Mm,
and Medicare doesn't like to pay any money. And now Medicare is not wanting to pay any money for long distance, right? For telehealth long distance. And so since I see people all throughout the US, I'm in PsyPack now, so I am licensed. I can see people in every state except for like four of them,
that's
which
so cool.
is so exciting. Yes.
Yeah.
It increases the pressure, it really does. But so especially the marketing pressure, that's a whole different story. So the problem anyway is that if I had to see every one of my patients, let's say I had 20 patients on my list, just even right now in the state of California, I have 6 and they don't live in the same cities.
Yeah, so like how that because like I know like Medicare has been doing like they have to be in person for quite a bit of the sessions and like that's not possible.
It is not possible. So I had to do a Medicare opt out. And so as a result of that, the people that I've been seeing, the people who were in my flow client, the people that I work with the most, the women my age, trauma, high functioning, unless I can pull all of them from this area where I live for Medicare, it's not going to happen. And I'm in Florida, so I'm a little fish in a little pond with a lot of big fish around me.
Yeah. And now with the
Right?
side pact with like having to do all those states, like yeah, there's no way you can do Medicare because like you can't like if someone's in let's say like I don't know where all side pact is because I'm not a doctor, like say someone's in like Wisconsin and you're in Florida, like there's no way they can
No,
like get to you.
it's not. Yeah. So I had a lady call me from North Carolina, had another one from Texas. All of these people, but it's not possible for Medicare for me to hop from state to state to state. I mean, well, I certainly racked up some frequent flyer miles, but
Yeah. I mean there's
can't
different things
afford
in
it.
each state, but yeah, it's pricey.
Yeah, yeah. Could you imagine what your session fee would have to be for that?
Oh my God. I couldn't even imagine it'd be like in the thousands to pay for the flight, hotel, like renting a location to have the session.
Yeah, it just pisses me off so bad. Oh, so I'm not sure if I was supposed to swear, but I
You
didn't mean to.
you
Anyway,
can
yes, I
swear.
did.
I don't
The
care.
reality is that I have a foul mouth. The thing is that Medicare, and this is the thing with our federal government, they always, this whole thing with Medicare, and it doesn't matter, Democrat, Republican, none of it matters. They all say, oh, we're here for you. We're doing our best for you. Oh, geez, we have to raise our rates because doctors are raising their rates. Are you nuts? I didn't raise my rates. They will not pay me any more than what they agree to pay me. And so they charge their consumers more and they cut my rates by 10-15%. So they cut my rates this year and they told me how to do everything in person. And it's like, you know what? I'm so done with them. I'm just so done with it. So I switched.
That's like part of like why a lot of therapists are going to the private pay world because it's so much bureaucracy and everything.
There really is. And the problem is that they're liars.
Yes.
Right? If they can't fill their own pocket, they're going to try to convince us that they're doing what's right by us. And it's so frustrating because they're not. A lot of people got really mad at me because I lost. How many people did I lose? I lost 3. And then the other ones who are having to pay cash who decided to stay with me have gone to like every other week or once a month now because they can't afford it. And Medicare won't pay out of network.
What?
Mm-hmm.
With
It
like
won't
it
pay
makes
out of
sense why
network.
you're like be changing your flow client to something
Yeah.
else.
Yeah. And the thing of it is, it's like, and it's paid by region. So, for example, in California, I was making 40% more. I moved to Florida and switched over to the Medicare here because your Medicare is based upon where you live, not where the patient lives.
Oh.
And right, and I lost 40% of my income because I moved to Florida.
That
Yeah,
just makes me
it's a
sick.
racket. It is. It is a racket. But yet they tell our patients, oh, you know what? The providers are raising their rates. We have to raise your rates because it's costing us more money. And seriously, I haven't. You can't raise your rates with Medicare. Well, you can't. You can go in and negotiate once a year for like a 2 or 3%, but that's about it. So it's just a horrifying mess.
Even like getting them on the phone to try to negotiate is ridiculous. Like I've been trying to get in touch with Highmark for months to talk to them. And I call or use the chat option, everyone's too busy, try again later. Even when I try first thing in the morning or towards the end of the day, like when there are like less calls, I can't get anyone.
No, because they set those chat options. That's an automatic thing. So unless someone is logged in or they answer it, but they'll just look at their computer and go back to doing what they're doing, right? Why would I want to answer that? No, thank you. I'm not going to deal with that crap. It's so frustrating. Headway's the same way. I quit Headway. I have quit Headway multiple times. Yet Headway never actually does anything. They just ignore me. So I don't even know how to get rid of them because you can't call them. And if you email them, they ignore you. If you chat with them, they ignore you. So it's like, what do you do? So I'm stuck with Headway, but I'm not, yeah. But if they get dinged, they're the ones who are getting dinged, not me. So yeah,
Yeah.
it's crazy. So I
And
just
yeah, I
don't
mean, like,
accept
on
them.
that end of things, like they're actually the ones handling the insurance aspect of stuff. But if they're keeping you on their network and you're not want to do anything with them, then that's
Hmm.
a whole other issue.
Right. Yeah. That has been a colossal waste. So anyway, I've changed my full client and I've gone back to what I've always done. I'm not sure if you know, I'm a forensic psychologist,
I was read that on your website, but like, I didn't know like what all you've done with it.
right? So I do testing, assessments to uh, in fact, I'm currently taking a refresher course on competency. So, are they competent to stand trial? Not guilty by reason of insanity. How does that work, right? When people do that, trying to see whether or not they meet the criteria for that. Providing treatment to people who are in prison who are connected with the legal system. So the forensic psychology can go in a lot of different ways, but really what it means is you're dealing with people who are connected to the legal system in one way or another.
Okay.
So I started out my career a billion years ago doing domestic violence. So in California at that time, I don't know what the law is now, but at that time, if the police were called to your home for domestic violence, both of you had to attend a 52-week domestic violence program.
52 weeks.
A whole year. And at the end of that, your clinician could say, you know what? You have not demonstrated any progress or any change at all, and I'm not graduating. Of course, that's like something you'd really want to say to an angry man, right? Or
Yeah, it's
angry
like
woman.
that was like make me so nervous. Be like if I worry about them coming after me, like by saying no, you're
Yeah,
not leaving.
yeah. Well, so what you end up doing is I mean, you have that right, but what you do is you're every month you're giving them feedback on how they're doing. And you're also giving that feedback to the judge because the judges don't really care. You know, if you threaten a judge, you end up just going to jail. That's what, it's a nudge, nice little nudge to clean up your behavior, right? So you learn how to speak. You no longer say things like, I'm so mad, I want to kill you right now, because that's a bad thing.
Yeah, it's a good way to get thrown in prison, especially towards a
Yeah, yeah,
judge.
yeah, yeah, yeah. So, in fact, I had a person do that with me at one time. That was very scary. I was an intern. It was one of the most important lessons I learned. Was as a clinician, if you're face to face, you always sit closest to the door. That's the number one lesson. Don't have any, and no one blocks your access to the door. Because if you got to get out, I mean, and that's just it. Because I had someone at one point threaten to kill me, and he was a very, very scary person. He was huge, this huge man. He was a strike two sex offender, very violent. And it's tricky when you provide treatment to violent people because you don't want to teach them empathy. If you teach them empathy, you're teaching them how to be a better sociopath. Think about that for a minute. What does empathy do?
Yeah, it can be like a way to like manipulate people because then like you,
Exactly.
yeah,
Exactly. And so if you teach a sociopath or someone who engages in that kind of behavior, if you teach them empathy, so people who are classified as sociopaths, they don't go into the group setting, they go into individual setting because they have a lot of sociopathic tendencies. And so this individual, he, I mean, he was a classic conduct disorder child, but somehow he managed to get a waiver and he got into the United States military. The specific, I'm not going to say the specific branch, but he got into the United States military, and then he his abilities for physical violence and success overcoming a threat were substantially increased, right?
yeah, and because that's what they teach you. They teach you how to do those things. Like,
Yes, exactly.
yeah,
So
I
what ended, yeah. So it ended up that he was a strike two sex offender. So that means that he did some really bad things to a female, and so he had to do domestic violence treatment. But so when I went to terminate with him because he was not making any progress at all, um, he threatened to kill me. Or, well, he didn't threaten to kill me. He said he was going to kill me. I've never been so terrified in my life.
I can. Are you still there, Paula? Sorry, everyone. She will be right back. Just have some minor technical issues. So while we're waiting for Paula to come back, like I'd love to hear like some of your comments about like what some of your things you've heard so far from Paula, or even anything about like forensic psychology if any of you are interested in that. And like I can always direct those questions to Paula for you like later on down the road. Um, there you are.
I hate it when it does that.
So do
I don't know
I.
why it's doing it today.
I don't know. So like so he like threatened he really threatened to kill you.
He did. Yeah, he was going to kill me. And so I'm sitting there, and up to that point, I hadn't been paying attention. Like, I mean, you go into session, but you don't, when you first start doing these things, you don't know what you don't know, right?
Right.
And so I didn't know that I needed to be nearest the door. I didn't realize that somebody would want to, like, I mean, you know it can happen, but it's not going to happen, right? And he says this to me, and I look at him. He's a giant. I mean, he's huge. He's almost 7 foot tall. He's a mountain of a man. And it's bulging muscles. His strength is intense. So then it's like, okay, can I be faster? Because in those days I was a skinny little thing, so I was like 140 pounds, right? He could snap me, and there was no way I would make it to the door. He was closer to the door. So I look, and the phone is also on the other side of the room. And what am I going to do with the phone, right? Maybe biff him in the head with it, but that's about it, because it's not like, even if I call 911, and first you have to go through this extension, right, in order to call out.
Yeah.
And then it's 20 minutes for the cops to show up. I've been dead already. So I stayed calm. My dad, one of the greatest things my dad did was he taught me how to play poker when I was a kid. And we used to play liar's poker. He'd say, Polly, you going to give me that dollar back? No. Let's see who can lie best. And then, of course, I would get in trouble from my mother for lying later on. But, for dad, it got me an extra buck. So
Yeah.
not like there's mixed messages or anything.
Oh yeah, totally.
So, right? So I used dad's liar's poker face and I just shut right down and started talking about, well, let's talk about that for a minute because I think you might want to consider what happens in California if you kill your mental health provider. Remember, there are new laws for that. You're already a strike two. It's not going to be another 25. It's going to be the needle. Am I worth the needle? Seriously. Never been so terrified in my life.
And you want to go back to that?
Well, but you learn from it, right? That's the
Yeah.
thing. You learn from it. So I ended up going from that and I went completely away from violence for a long time. I went in, I used to do child therapy, play therapy. I did Super Dinosaur Smackdown every week for 2 years. This child, he had to work through it, man. And he was T-Rex and I was Barbie. And every week, T-Rex would attack, stomp down, and kill Barbie. But he got through it. But that, just another form of violence, right?
Yeah, I mean, I can only imagine what he was seeing at home for him to be acting that part out.
Right. Yeah. And so he had a very, very trouble, and he was small he was like 6 when I was seeing him, and so I was seeing him and his sister. It was a very traumatic, tragic family situation, but I realized that I couldn't work with kids because I was so frustrated and so I became what did they call it? It's for children, certified trauma therapist or something like I can't remember what the specifics on my resume somewhere. It was a specific thing for doing trauma work with children. And one of the pieces that you do is you help the child sit with the parent and process it, right?
Yeah.
But if you have a parent who's still in denial, that doesn't work so good.
No, it doesn't.
And so it was a challenge for that to not evolve into an argument with the parent. I mean, it was just horrifying.
Yeah,
So I couldn't do it.
yeah, bulk of my work has been with kids and their families, and the parents are the hardest ones to work with. Like,
Right?
I would love the kids that I've worked with, love them to death, like want to take them home, all the
Yeah.
things. The parents wanted to smack me on the head. Like, not
So,
like, not literally, but like just normally, like, why are you not seeing this? Like the things that you are doing as the parent are directly influencing your child's behavior. Like, stop
yeah,
doing these things.
exactly. And so I'm not, and so you kind of know me a little bit, but I have improved dramatically. But I'll have I have been known to say things. Are you really this dense or are you just playing stupid with me? Because, and you know what? It turns out people get a little pissy when you talk to them like that.
They're like, you're braver than I am because I've wanted to say those things to parents, but I never have. I'd say it afterwards when I want to vent to myself, but
Yeah, no, it's not so good to say it to them either because it really does become an argument. It's like I remember this one lady telling me, oh, how everything that her child told me was wrong, that it was all a lie. And I said, that is really interesting because according to the CPS report, the officers who showed up found this evidence, this evidence, this evidence, this evidence, and you're trying to tell me that the child is the one who is recreating the reality. Seriously? You haven't been doing much work with your therapist, have you? And at that point, she got up and left.
Yeah, because that's the hard part too. Like, especially
And the
when they're younger
CPS agent was
kids.
on the phone with me. Huh?
Because, okay, just like when you're working with kids, like if you don't have like a decent rapport with parents, like
Exactly. It
nothing.
has to be. Yeah.
Yeah, he's like nothing's gonna get done. And then the
Yeah.
kids will. It's like to try to triangulate everything. It's been. It's like sometimes I'm just like I just want to talk. I don't even want to talk to the parents. I'm like, let me just work with you. Like I know things are crazy at home, and like mom and dad are doing X, Y, and Z, and you have like feel like you have no control because you really don't have a lot of control. But let's like
Mm,
control you. Let's work on controlling you.
yep. But they don't teach you that when you're learning to do this. They don't teach you that.
No, they don't.
They,
And the
they teach you that in graduate school? No, they
no,
don't. No. Use this technique, use this technique, use this technique. They don't tell you what to do when you got a parent who is not willing to change their behavior. And it's always the kid's fault, right?
yeah. I think like always boggles my mind too is like a lot of the jobs that we can get out of grad school in the field is working with kids
Mm-hmm.
or doing some form of in-home therapy. Like my first job out of grad school, so like kind of in grad school at the same time, was doing family based. So while I was in grad school, getting my master's, I was a family based bachelor levels therapist, going into the homes, doing legitimate family therapy, trying to do all these techniques that I had no knowledge of until
Okay.
I was done with school.
Yeah, exactly. And think about this for a minute. You're going into someone else's home. How dangerous is that? And I say this only because I did the same thing. That was one of the things that I had to do as well when I was coming up. I did the um, PCIT. I was learning PCIT. Are you familiar with that? Parent Child Interactive Therapy.
Yeah.
Fabulous, fabulous thing. But during my training for PCIT, before, because you had to make sure that they were appropriate. So this organization had me going into the home and trying using other techniques first before you did PCIT, because PCIT is no good after age 6. So,
Yeah.
um, how dangerous is that? And some of these places that I was going into were in parts of town that you don't want to drive through, much less park your car because it gets dark at 3, right, in the
Yeah.
winter, and walk through these areas to go. It was horrifying what you're being asked to do.
Yeah. It
So,
was, I was lucky enough to not have a lot of like dangerous families, but there was one case, and that was like this final straw for me with doing in-home therapy or like driving around. And as a child, he had a lot of sexualized behaviors, and I had newly given birth to my son. So I was a little bit still dealing with that stuff. And he touched me inappropriately a couple times. And whenever I brought it up to his father, he's like, "No, he didn't." I'm like, "Yes, he did." And like he's been also trying to be physically aggressive towards me. We're not allowed to touch your child. This cannot happen. And I was like done. I was like, I told my boss, it's like, take me off this case. I cannot be with this child. Like I don't feel safe.
right. And the father, no, he didn't. Yeah, because I have motivation to lie to you. Why?
Right? Like, why would I say a 10, 11-year-old boy is touching me? Like,
Mm-hmm.
no, I have no desire to do anything with the children. No, thank you. I'm happily married. Like,
Right, exactly. Well, the thing is that leads me to how I ended up where I'm at. Because the reality is that those individuals, you know, managing your affect, learning how to emotion regulation and affect management, all of that stuff is a learned skill. It's
yeah,
learned. And if nobody teaches you, you can't know what you don't know.
that's very true.
And so when I went to work with the Department of Corrections and Rehabilitation, that's what I learned. Actually, I got to learn God's sense of humor first, because I had been working against, uh, as a proponent for children against child sexual abuse and this and so when I went to work with the CDCR, um, I ended up being placed in the SNY, which is the security needs. This is where most of your sex offenders are hiding out. So I went from working with victims to perpetrators, but that I learned a huge lesson about judgment on that, and that has stuck with me. So that was very beneficial. God has guided my hand through every step of my career. And as much as I try to get away with it to do my full client, he just keeps bringing me back. Nope, that's good, good, good. Come on back. Yeah, you just come on back over here.
And it's definitely telling you that it's definitely kind of yes, you do good work with them, but apparently you do better work with people that are angry and that need help learning how to manage their emotions.
Yeah, yeah. Because oftentimes, I'm going to tell you, it is when you get to know them and they develop a trust with you, and that takes a long time because
Yeah.
they've had so many people violate their trust, and you are part of the system. And that's the reality of it. Someone told me that once. They're like, "You're part of the system." I'm not part of the system. Oh yeah, you are. If you're not an inmate, you're part of the system. And at the end of the day, that is the reality. So for them to trust you even a little is huge because they learned early on not to trust anybody.
Yeah.
Right?
I mean, your demeanor that's feeling like kind of lends to like them like being like a trustworthy person. So I can like see how they're actually able to build trust with you, which is huge.
Mm-hmm. It is huge. So that's part of the reason I think that I am as plain spoken as I am. Will you do me a favor? No, I don't do favors for anybody. I don't care. I do no favors because that's a setup, right? If you do me a favor, now I've got something on you. I don't do favors for anyone. As I learned that, there's the greatest little book. It's called shoot, I have it on the bookshelf up here too. I don't know what the hell it's called. But it's the Anatomy of a Setup is what it's called. If you can ever find this book, it's totally worth reading because that's the group of people I work with. And I love to work. The Anatomy of a Setup. You always got to be thinking 4 steps ahead.
They're like probably pro chess players.
They should be, yeah. If you could keep them interested long enough. But it's so boring. That's their thing. They've got to be. But their brain works like that all the time. That's how your brain used to work when you were young,
I can see that. I see
right?
that with my kids because they're like
Right?
going like they'll start something and then they'll like be like go the next second they're somewhere else. I'm like, how did we get from here to there? Like that makes no
Exactly.
sense.
And so I often view them as really children in grown up bodies. I had someone say to me one time, I never could have children and I wanted to be a mom. That's all I wanted to do was be a mom. And she told me one time, she said, Paula, maybe you're not supposed to be the mother of one or two. Maybe you're supposed to be the mother of many. And I never understood what that meant until later. And that's exactly how it turned out. Is because many of them, most people will have mother transference to me. Even those who are older than me will have mother transference.
I see that.
So, yeah. So it's the kid thing. So what are you doing now? Are you still doing family?
No, I mean, I learned a lot doing families. I loved it at the time, you know. But now that I have my own family and I'm growing my own family, I have. moved more towards kind of like the caregivers, the overrun caregivers, the burnout people. But I'm also have a very special place in my heart for people that have had a lot of childhood trauma and there's like that neglect and that kind of like struggle with knowing how much whether or not they're too much for people and like asking for what they need.
Hmm.
And I love like kind of like giving them that space for growth and just healing because a lot of them like they didn't have the people that they can go to for unconditional support or the love. And the people that I have now that are like that, I can see them blossoming with me and just
Hmm.
like actually being willing to talk about their emotions or even express their emotions because like a lot of times it felt unsafe for them. So they
Hmm.
would kind of like lead towards like the anger type situations where
Right.
like or be violent. But like I have some people that I'm like the only person that they can cry in front of and not feel less than for crying.
Touch. Yeah, exactly. That's such a special feeling, isn't it?
Yeah. Like it's
To be that one. I was trying to explain that to my husband and sister yesterday. It's like it's to know that somebody feels safe enough with you to show their genuine emotional state.
yeah, it is
That's
it's,
that's a
it's
gift.
yeah, it's such an honor too. Like it's
Hmm.
but because I've it's like I'm strictly virtual, just like you are. And like just to be people to still feel that safe energy with me through a
Hmm.
screen
Yeah,
is huge.
yeah, it
And
truly is. Yeah.
I just love it. I love like just helping them heal. And I've been working on getting my EMDR certification. I'm like almost done with getting my EMDR certification. And it's been like such a great feeling. But I've been like helping people like kind of like grow again, kind of like how like you like view your clients as like children in grown up bodies. It's kind of like how I see my people as well a little bit. Like 'cause they
Hmm.
didn't get what they needed emotionally growing up. They're having them find ways and sport ways of getting that stuff now.
And are most of them female?
Yes. Well, I have a mix actually. I have actually right now I have more men on my caseload than I do women.
Yeah.
And I have such a like the men in my on my caseload. I'm so happy that they're actually willing and like actually getting to this part to like express their emotions. Because like
Hmm.
society is so like men don't cry, men don't do this. I'm like, stop it. Yes, they do, and they need to. Because like otherwise they get stunted and then their romantic relationships suffer, their kids suffer. Like let them cry. Like let them feel. And like
Hmm.
teaching them that it's okay to do these things.
Yeah, exactly. Exactly.
I have a one man on my caseload. Him and his wife had a miscarriage, and he's never talked about it since like whenever
Hmm.
it happened. And then a few weeks ago, he brought up to me about wanting to actually get a memorial tattoo for the lost child.
Wow.
And it's been over 20 years
Yeah.
since that miscarriage.
Well,
I'm
that
like,
makes sense. My husband won't talk about the death of our child. He won't talk about it. So it's, I get it. It's the, I don't want to talk about it. It's that depression in men. And it is so prevalent. There's so many, that's how they were raised, and it's so heartbreaking. And we did that.
that's the part. Like, I'm trying to like break the cycle with my son. I have a son and a daughter, and I'm like trying to be like, no, like you can cry, but we also have to learn how to handle it on the back end. Crying is fine, but we also have to learn like good coping skills whenever things are going on because you can't just like go around throwing your body down on the floor and scream and kick your legs. Like,
Exactly. Right. I know that's that frustrating. You want to, I have been, yeah, yeah. It's funny. People tend to frown on it when you're older.
yeah, a little bit. Like, there have been plenty of times where I want to just like scream and cry at the world, but it's like, no,
Yeah.
you can't do that. It's not okay.
You were saying a little bit about EMDR. I'm looking about getting EMDR certified. Where would I go to do that?
Um, EMDRIA, so EMDRIA is like the international gold standard for EMDR, and that's who I'm getting certified through. And the reason why I actually got into it and I was able to do it is Pitt University has a did a grant for all of the therapists in Pennsylvania that wanted to sign up for it, and like you could get
Uh-huh.
certified for free. Well, it's free, like through the grant.
Wow.
So like there's like 1,000 of us that did it, and so like we're all like gonna be EMDR certified by the end of the year.
That is so cool. I'm looking at doing it. I could never afford it. And that's because it's really expensive. And
Yeah,
so trying to find something that's low cost, and you see these people out there say we're going to do it, and it's like I don't know. So I like that I know EMDRIA, so they need to probably be affiliated with them, right?
yeah. Well, like so that like they have their own like they have their own training, their own um supervisors and all the things because it's an international it's the International Association for EMDR. So it really
And it's
is like the
all
gold standard.
okay. And do you have to go to class, or is it all on the computer?
I did it all virtually, but they do have like retreats. I think the one of the instructors for mine, he went to Hawaii for his,
Ah,
and so he like did it for like a he went to the training and then got a vacation out of it too by going to
kind of
Hawaii.
good luck. And he only paid X thousands of dollars.
Right? Yeah.
Wow, fun.
Yeah. But once I'm done with my EMDR certification, I'm gonna get certified in hypnotherapy.
I started doing hypnotherapy, and then in fact, I do a little bit of it. I'm not certified. I was doing it, and I had to stop because of funding, right?
Mhm.
Um, but so cool, so cool.
Yeah,
Yeah,
there's I feel like there's so much overlap with EMDR and hypnotherapy. Like whenever I've gotten hypnotherapy myself, a lot of the like prompts and the grounding techniques and everything like you do in hypnotherapy are very similar to the ones you do in EMDR. So I feel like it
really.
lends itself really well. And that's like kind of like the more like body connection piece to hypnotherapy
Mhm.
because you kind of like explore like where are you feeling the barrier with like the different thought processes with hypnotherapy than you do with like
Hmm.
EMDR. I mean, yeah, they do like you do the body scan in EMDR, but it's not as intense as like with hypnotherapy.
Right. Okay. Okay. Wow. I got to do it. It's on my honeydew list. If you saw my desk, I am a pink post-it note person. I love pink. Of course, I'm in yellow today. That's because I have striped pants on. I don't have any non. Anyway, the point is that my organization system is very interesting. It all begins with the pink sticky note,
Okay.
and then it works its way finally into the book. And if it doesn't get done, it goes into the book because there's three other steps in between, right? So these are the things that I have been avoiding the longest. So hopefully the EMDR will get done before it makes it to the book.
Yeah, I mean, hopefully. I think they might have payment plan options that are a little bit more reasonable now, but it's still
Yeah,
like $2,000-3,000.
yeah. It's spending. It's
Yeah.
spending.
But
So,
it's such a great tool. I use it with I yes, I use it for trauma, but I also love using it for anxiety.
mhm.
Because like even with anxiety, like you get in that loop in your head of like all the negative thoughts, all like just constantly going, going, going. And you can find like the first instance when the anxiety happened, like whenever you're a kid or something recent, and it's kind of like having the resources in place before you obviously you do the processing. And really, you really have to do that. But just even going to that touchdown point, clearing that out works great for anxiety.
Mm.
Because once you can fix the root of the issue, everything else kind of just like falls in place like dominoes.
Isn't that it? That's it. I do primarily ACT work. And so really that's what I focus on is what do you want it to turn out like? And so how can we, if we just accept, and it was my own journey that taught me that because I am the queen of anxiety. I'm an anxious mess. And so when I finally just accepted that anxiety will always be with me, I can choose to attend to it or not. That's my decision. When I just accepted that, oh my God, life became so much easier. So I'd feel anxious and be like, oh, hey, how you doing? I gotta go. I'm busy over here. Welcome back. Uh, it's just someone else who lives in the house with me.
Yeah, I feel that too because I get really anxious myself. And like there'll be times where just like, okay, this is like, do I really need to be anxious about this thing right now? Whenever I have
Yeah,
20 other things on my list that I need to get done. Like,
yeah,
no. Like this thing can like wait or just go away. I don't need to worry about it
exactly.
right now.
Yes. It's like that damn kid going, no, no, you need to be patient. I will get to you, but just not right now. So, yeah,
Yeah, it's so true. Like my kids are like that too. They're like, "Mommy, mommy, 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 mommy." I'm like, "Mommy's working." I'm like, "Please just give me a little bit. I'll be right there."
yeah, yeah. Just be patient. Yeah. I,
Yeah.
so I have to wrap it up because we've been visiting for a while, and my sister has her big spring fling party tomorrow, and she's popped her head in here 4 times now, wondering why I'm not helping set up. So
Yeah, but
yes,
this has been great. Thank you for meeting with me. And like, I'm so sorry about tech issues like on my end and like everything. It's been crazy.
it's been a tech challenge today, but yeah. So you decide you want to visit some more at another time? Let me know. On a personal level, I really enjoyed this. I really enjoyed being able to get to know you a little bit better. I think very fondly of you when you are one of the individuals within our group that I'm just so blessed. I truly feel blessed that I have been allowed to connect with you a little bit, and I just wanted you to know that.
Well, thank you,
So
Paula. That
thank you.
really means a lot to you. And I love working with you too in the cohort. Like I learned so much from you. Like all of you have
Yeah.
so much experience and it's like I love learning from all of you. Because like I feel like I almost feel like a baby in the group because I feel like I'm the youngest. But,
Right,
but I
right,
just love
huh?
I love like working with all of you.
Absolutely.